Welcome to the Asia Climate Finance Podcast, where our host and expert guests delve into and scrutinise the pressing issues and emerging trends in climate business and climate finance. We greatly appreciate your support. Please like, review and subscribe to the podcast to help us grow and reach a wider audience. Be sure to take note of the disclaimers at the conclusion of each show. And now, here is your host, investor, analyst and author, Joseph Giacobelli.
Good morning, good afternoon and good evening, wherever you may be listening from. Welcome to episode 73 of the Asia Climate Finance Podcast. It's great to have you joining us for a fascinating episode on not so frequently discussed subject in the context of climate finance. Today we're diving into the vital intersection between climate, nature and health. That's an area many of us rarely consider when we think about sustainable development or infrastructure. So in the last episode we discussed nature's infrastructure with two senior representatives from the Asia Infrastructure Development Bank, or AIIB. Today we have a second episode with AIIB, but discussing global health in the context of climate finance. Our guest is Dr. Vera Siesjö. Pardon my poor Swedish pronunciation. Vera is a leading global expert whose career bridges global health, climate resilience, and development finance. We'll unpack what planetary health really means and why it's not just about saving polar bears. Vera reveals how climate change, pollution, and nature loss are already shaping health outcomes across Asia, and how new strategies aim to tackle both health equity and climate risks at once. We'll hear fresh perspectives on AIIB's evolving role in health. This includes landmark projects in Indonesia and in Brazil. We also discuss how digital transformation is connecting even remote communities to vital health services. You'll also get an inside look on how multilateral development banks are seeking to break old silos and unlock new funding streams to make healthier people and a healthier planet possible together. It's an episode packed with real-world examples, bold ideas, and practical takeaways on advancing health and resilience in our changing world. As always, please do reach out for comments, or if you have topics or guest ideas, our email is at the top of the show notes. Enjoy the discussion. Hello, Vera. Thank you so much for your time this morning. How's everything? Are you in Beijing?
Thank you, Joseph. It's a pleasure to be here. Yes, I am in Beijing, sunny Beijing.
Nice. Very jealous. I haven't been there for a while. I'm very much overly due. So once again, thank you so much for this. This is a very, very special because it is a topic that we haven't tackled about climate health. But before we get into the topic, could you tell us a little bit about yourself, maybe a passion or a pet project, something beyond your formal bio, which is in the show notes?
Absolutely. So I am someone who has had, I think, close to 2 decades now. I'm getting older of working in the what I used to call the global health space. But hopefully, as we will get into this podcast, I call myself more working in the planetary health space these days. And so I've been working mostly in low middle income countries and really trying to see how we can ensure equitable and accessible healthcare for people who have the hardest access to healthcare. And there are unfortunately many, many millions of people still in the world. And I think maybe something that brought me on to this paradigm shift from global health to planetary health was that in 2013, I was brought to the Philippines, actually, to work with mayors and governors in central Luzon, which is the central islands of the Philippines. And if you remember, this was a year that one of the most devastating typhoons hit mainland Philippines. It was called Typhoon Haiyan.
Right.
And I came there to work with some organizations, including the UN. And what I was seeing on the ground was absolute devastation. Healthcare facilities, schools, roads were completely wiped away. And as we were trying to think with this collaborative of mayors how to rebuild sustainable and resilient health infrastructure, it really struck me that what we are facing today in global health is not only the threat of diseases or the lack of nutrition and so forth, but it's increasingly the effects of climate change and nature degradation. And that, I think, really made me realize that we need to focus on what actually determines our health and what will be the biggest global health challenge of this century. And I think without a doubt, I would say that is climate change. So that's kind of what brought me into this rethinking about how do we need to tackle this. And yeah, I think we have come a long way since 2013. So hopefully I can share some of that insight.
Right. So now you're with the Asia Infrastructure Investment Bank. So could you give a high-level description on how a kind of infrastructure-focused MDB, although I know it's got the infrastructure word in it, but it's not necessarily, it's a kind of broader definition of infrastructure, I guess. How does the AIIB work in the area of health? What's the connection?
Yeah, so we are sort of the newest multilateral development bank in the world. We were established about 10 years ago, so we celebrated our 10-year anniversary this year.
Right.
And we were already, our core mandate is infrastructure for tomorrow. So really building resilient infrastructure in water sanitation, urban development, and so forth. But I think COVID kind of catapulted us into thinking about the healthcare space. And during the actual pandemic, we set up a crisis recovery facility that enabled a lot of lending to countries to really cope with the consequences of COVID. So I think that this was sort of the outset of how we started to think about this. And we see an enormous demand in a lot of our member countries where the huge health infrastructure gaps that needs to be met. And that's how we sort of came to launch our first health strategy and the only health strategy from any MDB that has been launched after the pandemic. And that was last year, actually, in 2024. So we have to date, I think almost $5 billion in lending for health projects. And very proud to say that we collaborated with a lot of the other multilateral development banks in this space. And so really sort of moving forward in that space now to tackle what are some of the sort of greatest challenges, specifically in this region, but beyond as well.
Great. Just to put a little bit of color on that, could you walk us through maybe one of AIIB's health investments to date? Maybe we can talk about the largest one, which is, I think, almost $1 billion into the Indonesian health system modernization project. And also, at the same time, could you kind of explain a little bit on what measurable outcomes it is delivering?
Yeah, in 2023, we approved sort of a multi-lending facility together with Islamic Development Bank, Asian Development Bank, and the World Bank. And this was about $4 billion to the Indonesian government for modernization of the health system in Indonesia. So this was particularly focusing on primary healthcare. And for anyone who's not very familiar with health in general, I always say that primary healthcare is where we should spend really our core financing, because it enables to prevent and detect early diseases and really allows us for not reaching the really high healthcare expenditure at tertiary level. As soon as you step a foot into a hospital, your cost has multiplied. So it was really about focusing on primary healthcare. Indonesia is a very large country with a very large population and geographically very dispersed with a lot of different islands. So this was really focusing on helping the Indonesian government to strengthen their primary healthcare facilities. And we're talking about thousands of healthcare facilities here, tens of thousands of healthcare facilities. And we specifically focusing on, a lot of these healthcare facilities had lack of capacity and trained staff. It had lack of capacity of technologies and digital systems in place. It had a lot of different issues, but our specific component of the work was really focusing on the medical equipment and technologies at the healthcare facilities. And that is also was the interesting part about this project was, one, we managed to collaborate with different multilateral development banks in a very coordinated manner. And that facilitates both the work for us to learn from each other throughout the multilateral development community, but it also allows for a member country to have a more systematic approach for their lending and a more integrated approach. So I think the important component, and I think what was really critical about that project, it was a system approach. It was really about the healthcare system. It was really providing an overarching sort of enhancement of the health system. So that was critical. The second part was, it was really looking at tackling equity gaps. You know, a lot of healthcare facilities are in hard to reach areas, and those are many times where the populations have the least access to services, the lowest level of actual ability to reach any type of diagnostics and equipment and so forth. So it was really looking at the systematic approach. So I think that was the real added value. So it was really about the scale. It was really about also the infrastructure focus, really trying to look at what was missing. There was a huge analysis conducted first to really identify the gaps within the healthcare system, and then jointly work with different development banks in a more integrated approach where we can leverage technical assistance, we can leverage financial lending capacity and so forth. So it's also a more synchronized way for our members to not have triple or quadruple, in this case, administrational burdens.
And sorry, the second part of the question was, what measurable outcomes have you seen this investment or this facility delivering so far?
So this was a project that actually spans until 2029. So it's just been sort of initiated, this project. So it's really hard to measure any kind of effects right now. But what we see is improved.
Right.
What we want to see, improved access in terms of patients, improved access in terms of clinical and laboratory analysis and so forth. So basically, you having or someone in Indonesia having increased access to healthcare services and improved technical capacity to conduct that in a qualitative way.
Right. Got it. So it's still early days, basically. Great. Now, talking about a specific report that AIIB recently published, the Asian Infrastructure Finance Report on Infrastructure for Planetary Health, which kind of focuses on integrating nature, climate, health priorities into every infrastructure investment. Can you speak to how this approach could actually unlock financing for planetary health?
Yeah, so I think I maybe want to go back also as we started this conversation. I mean, if we look at the overall mortality and morbidity globally, so what people die from or what do they get sick from, we see that almost a third of the total burden of disease or the total burden of mortality globally is due to sort of known environmental factors. So that is having access to clean water, having access to clean air, having access to education and so forth. So it's really, really important to, first of all, understand the real threat of climate change and nature degradation to human health. We have almost... And air pollution right now is the largest environmental cause of disease and death. And we see that 90% of the air pollution related death occurs in low middle income countries. So I always say in a way that the importance is to understand, maybe our big mistake when we started to talk about climate change is that we envisioned this polar bear on a melting ice shack somewhere in the North Pole. But what we should have placed at the center of that conversation is actually our own survival and our own health and well-being. And that's where we're seeing right now. So we're seeing this enormous change in what we actually get sick from and what we die from. So I think with that, we really try to see like how are these interlinkages with climate and health and nature, and what can we do from an infrastructure investment bank approach. And the way that we have approached infrastructure many times is really to mitigate the excess death or the harm to the environment and so forth. But we really haven't looked at what is the upside, like what can we do to maximize health outcomes? What can we do to maximize nature conservation, restoration, or climate mitigation adaptation through infrastructure investment? And that's what we really try to show with this report, to say that there is such an upside and we do have much better knowledge. We have progressed with our scientific findings in the last 10 to 20 years. And so now we have much more knowledge on how we can actually build up that. So, and that really has to do again with bringing back this equity perspective I spoke to before, because we know that many of the climate hotspots, obviously we're sitting on this Asian climate podcast that really looks at Asia. And we know that the vast majority of the climate hotspots, or many of them, are in Asia. We also know that the people who will be most affected by climate change are people living in poverty, women, children, elderly populations, and these ones are also the ones that are hardest affected by the health consequences. So that's what we really try to bring into this, and to say that let's use health as an argument for climate change or climate change investment. Let's use climate change as a way to attract more financing for health. And I think there's a huge upside on how we can change that pendulum in a way to think more holistically and to try to break these silos between what are sort of the realms of climate change investments and financing.
Right, but in practical terms, Vera, how is AIIB working to bridge the financing gap? Your report highlights that less than 1% of multilateral climate funding addresses health directly. So how are you bridging that?
Yeah, we have started to do a couple of interesting things that I think is worth mentioning here. So one was that last year we launched a new policy-based lending tool. So it's called a climate policy-based lending instrument. So it basically allows us to provide financing to member governments for them to implement or to support their implementation of a set of different climate actions. And when this was set out first, it was really looking at climate change. But then we started with the lens also of this report, started thinking in a more holistic way. So one specific project that we have in the pipeline now is with Brazil. It's almost a $1 billion lending to the Brazilian government, where the Brazilian government has incorporated both climate mitigation and adaptation measures, really related to both carbon markets, facilitating private investments into the climate space, but also incorporate the health and climate angle. So we're looking at a new set of policies that they are now looking at, both for the adaptation and mitigation of their national health system. And this is probably, if not the largest public healthcare system in the world, it's up there, and it covers services to almost 90% of the Brazilian population. So this is a way to incorporate using the climate policy-based lending tool, but we're incorporating also health components. And I think likewise, with any project, you could really look at how do you optimize and how do you look at specific projects. We had one park restoration project in Pakistan where we actually did an analysis of not only what is the return on investment for the projects in terms of increased real estate prices, but really looked at what are the overall health outcomes, what are the reduced hospital visits, what are the increased air quality, what are the flood mitigation measures that are sort of resulting as a result of this project. So I think there are many ways that we're doing it, and I think we should really think about how do we incorporate and think more holistically in these type of projects moving forward. I always say what is good for the planet is good for us, and the other way around. And I think we need to be able to carry out that thinking throughout all of our projects.
I was going to move on to the kind of the investment strategy and kind of finance related questions. Before I do that, I'm still a little bit not clear on something, Vera. So, I mean, you're a leading global health expert, but I still don't fully understand how that marries to measuring the effect. I mean, obviously, less people dying means the workforce is larger and so on and so forth. So I see the obvious, but as a bank, when you are trying to allocate funding, do you have some kind of data points that you use to measure, or that's just part of a bigger and more global kind of approach to things, if what I mean?
I'll try to answer as I think I understood the question. But I mean, in terms of the projects, if we optimize, most of our healthcare projects are sovereign-backed financing. So these are governments that are trying to invest in strengthening public healthcare systems in some way, shape or form.
Right.
Although importantly, I think, and hopefully we can touch upon that, the private sector is a huge part of the service delivery in Asia. But when we do this, when we look at supporting governments to expand healthcare coverage and healthcare services, it is extremely important to look at the root causes. What are the root causes of a lot of these diseases? As I was saying, again, the return on investment on a lot of these projects, healthcare is extremely costly. Extremely costly. And if COVID wasn't the greatest example for how costly healthcare can be, and when we don't take care of our public healthcare systems are, so governments now realize that, of course, when we get the next pandemic, we would need to understand better how do we cope with these consequences. And equally, as you mentioned, it's also workforce. But it's not only about workforce. It also touches upon, if someone gets sick, that doesn't only affect that person, but it affects sort of a whole set of family members who need to care for that person when there is no functioning healthcare system. And I think our point is really to bring across, like, as our members are facing multiple challenges, they are facing lack of access to quality services, they are lacking access to basic infrastructure, whether that is road or transport. They are lacking many times real measures for climate adaptation and mitigation. And what we are sort of proposing to think about is, like, how do you think about this in a more integrated way, where you can really look at a combined set of effects and returns on investment. If you build a road, if you can maximize the safety of that road and minimize the carbon footprint of that road and maximize nature conservation restorations in surrounding areas, you can maximize the profit, if you want, from that road. So it's really, it kind of needs a paradigm shift in the thinking. We can't think in silos. A road is not only a road. Like, we see a road is actual traffic accidents in Asia is many times the second leading cause of death between people between 15 and 30 years old. These are enormous societal cost in the end. So we need to think about it's not as a good thing to do, but as a real investment. And I think that's where many times we need to shift to thinking that health is an expenditure. Health is an investment. When you invest in people, you have a functional workforce, you don't have to incur high out-of-pocket expenditure and cost downstream and really, really expensive healthcare bills, or even more expensive in consequences of pandemic spreads and so forth. So I think that's where we're really trying to sort of bring in a larger set of thinking around this type of planetary health thinking, if you want.
The messaging of planetary health thinking is very complex, right? I mean, it's not an easy message to, because I mean the world today is all about simplistic messages over 30 seconds in TikTok. So to communicate that, like you mentioned, I mean, I love the road example, because if you think about almost like an ecosystem, everything that is related to the road, the environmental impact of building it, the safety aspect, the safer it is, obviously there is an economic cost when there are accidents. So the communication of that must be very, very complex, right? I mean, do you find that? Is that a challenge?
I think it can be a challenge, but I think in the end of the day, it sort of boils down to really thinking about planetary health as the health of human beings and the natural systems that we depend on. So it's really about how do we maximize that? How do we make sure if we have a sick planet, we will have sick people. And sick people cost money, they can't work, they're incurring a lot of financial burdens on countries. So I think it's that paradigm shift. We can't have healthy people on a sick planet and try to move away from that. And Joseph, the thing is that we are only at the outset of this. We are seeing escalating consequences of extreme weather event, rising heat temperature, increased floodings.
Yes.
All of these consequences of climate change are causing absolute havoc in the health community. And again, it is the most vulnerable that are most affected. If we have children under the age of 5, or infants, those are the ones that run the highest risk of being affected by these consequences. Or elderly population, where we now have increasing in a lot of Asian countries and beyond. So it's really about protecting the most vulnerable, providing equity, and thinking in a new way about how we do things, and really try to see how we can optimize things. Like, let's not stay with the current paradigm where I'm the only scientist within the bank, and I always say we have to operate at the speed of science and not at the status quo. We have so much evidence now on what can be done and how we can do things differently, and I think we need to move in that direction.
The reason I wasn't being cold-hearted about the whole communication thing is that there's so many priorities around the world. And then if you think about climate-related priorities and global health, as far as I'm concerned personally, it's like the foundation. I mean, if we're dead, we're not going to be very useful to anybody, right? But at the same time, it kind of gets lost in the myriad of things out there because of communication. I mean, that's what the Asia Climate Finance podcast is trying to do, to help people raise awareness on some of the key trends and key issues. But I do think that global health, communicating planetary health is definitely very challenging. But anyway, I won't go on about it, but education is something of a pet project of mine. Moving on to a couple of other questions. Digital health is growing at almost 22% per year in Asia, yet AIIB focuses on hard infrastructure. How do you balance traditional health infrastructure needs with emerging digital health opportunities?
Yeah, so first I want to challenge you on that. I think we are very much part of our DNA as a bank is really about digital transformation. So that is very much core of our thinking. That cuts across all different sectors. But I think the importance here is I've worked a lot in the digital space, and we're really trying to see here at AIIB how we can leverage the innovations that are happening in the digital space and how we can really bring that forward to kind of leapfrog in terms of accessibility to healthcare services, improve access to information, and so forth. But I think that, there are different levers here. There's one is if you don't have the basic infrastructure, actual internet services, none of these tools are actually useful. So one really great project that we had now recently in Indonesia, we actually supported the Indonesian government with a launch of satellite. And this satellite is looking to provide internet connectivity not only to healthcare facilities. I think over 10,000 healthcare facilities are being provided internet access through this satellite, but also educational facilities and so forth. First of all, we need to have the basic infrastructure. Wow. That's really important. Without that, there's no equity.
That's a good point, yeah.
Second part is that we have so much now, and I think COVID again was a great sort of proof of concept of what we can do and how we can accelerate. Many people who have the worst access to healthcare, people who live really far away from healthcare services and providers. And telehealth and different health tools have really enabled us to provide a better and more equitable access to services. So that's really, really important. And I think for us as MDB, it's really about strengthening that digital health infrastructure. So it's very much part of what we do and really aligning with members' national strategies on how to build up and provide better access to these services. So yeah, very, very much part of what we do and what we want to do and how we want to support member states.
See, I had a misconception. So there's a lot of misconceptions out there. Even I had a misconception because of AIIB's work in hard infrastructure. But another question still related to kind of the finance side of things, with governments broadly funding something like 2/3 of Asian healthcare, how does AIIB leverage its AAA credit rating to crowd in private investment for health infrastructure projects. And here we can talk about the private sector involvement and catalyzing that.
Yeah, so I think this is the really sort of good part about having under the same roof as an institution, both private sector lending and public lending. So we very much recognize that there's a need to crowd in more private financing to increase access to services in health. So we can do that in different ways, and we have provided both lending to sort of PPPs, like public-private people initiatives that are looking at specific hospital facilities and so forth. But we also provide lending to different equity firms that are looking at private sector health investments. So that's also one part of what we do. But it's also about like de-risking financing, because in some of the areas we see that we have a additional sort of leverage where we can de-risk certain financing, also working together and co-financing with other MDBs that allows governments to have, and the private sector, to have more confidence in going into certain investment areas. So that's another way that we can also sort of crowd in more financing to the private sector space. And now we're seeing also an increase for sort of decentralizing or providing more regional distribution of actually production of medicines, production of certain healthcare equipment and so forth. And that was also a consequence of COVID, where we saw that a set of countries produced almost 90-80% of the total pharmaceuticals and very critical healthcare equipment. So now we can also look at how we can allow for more private financing to build up manufacturing plants in different members in the region that can have better access to both pharmaceuticals and to healthcare equipment. So very much part of our DNA, and we are hoping to accelerate this in the coming years as well, to crowd in more and more private financing. But also, of course, importantly, thinking about the equity aspect, where we're not looking at building sort of healthcare facilities or hospitals that are not providing accessible, and then by accessible, I mean financially accessible services. So also important to think about that these loans go into areas of investments that allows for more equitable distribution and access.
Vera, if I could ask, I mean, just to connect the economic case for nature investment with tangible health outcomes, could you maybe share some actual examples and put a little bit of color on this, share examples of how AIIB is actually financing these natural health infrastructure projects?
So we are in very early days of this, and I think nature finance, to be very frank here, it's an area that we're all trying to get more financing to. And we have a couple of projects. One project in China, where we're providing lending to private banks that they are then providing lending to smaller SMEs and so forth that are specifically looking at nature financing. So this is one way to look at how we actually can provide more financing to nature. I think that is where we should start. Just providing financing to nature is hard enough. And the way that we incorporate sort of what you call sort of ecosystem services into our project. So what is the actual benefit of having intact nature or financing nature, and what are the health consequences? We're seeing projects, for example, where we are looking at mangrove restorations, for example. We know that has improved outcomes for health, both in terms of mitigation of actual floods. It has a huge, as 3 times the carbon capture to normal forest. Many of these countries and members that we have are struggling with air pollution being something very critical. So when we invest in nature, we provide benefits to health. But we are in the very early days of really thinking about how do we bring these projects forward. We are now very much looking at how we can also crowd in more private financing for nature. We're collaborating with the different institutions and think tanks to put out a report on this now by COP30. So this is very much part of a progress. And the previous flagship report we published last year was on nature as infrastructure. So really thinking about how we can invest in nature as infrastructure, and that being maybe our most critical infrastructure. So I think I will be humble to say that we are early days with this, and we're really trying to get financing to nature now, knowing, of course, that the benefits for human health will be substantial.
Yeah, I missed the very important point you made earlier, that we are still talking about early days. And because we're still talking about early days about this, I've got a few questions about, typically in the podcast, I only have one question about the outlook. What do you think about the future? But in this particular case, I got actually three separate questions. One is, AIIB's health strategies emphasizes addressing health disparities, as you mentioned a couple of times already, and climate-induced health conditions. Which specifically health challenges in Asia do you see as most urgent for infrastructure investment now and over the medium term?
So I think there's multiple to start with, unfortunately. But I think what we're seeing right now is that we're seeing shifts in terms of the needs. We have a sort of what you call almost like a triple burden of disease. We see that there is an increasing demographic shift in the region. We're having more and older people in the region, which a whole new set of need for access to services that are not being met. So that's a huge part that I think we have now. I think only in China, we have almost over 300 million people over the age of 65, and they have their own unique sets of needs in terms of healthcare services. So that is a huge part. And this is actually a shift we see in most Asian countries as well. We have a elderly older population that will have their own specific health needs. I think secondly, we still face critical health infrastructure gaps. We don't have enough healthcare facilities to serve the population. So actually expanding access to healthcare facilities and services is still very, very critical. I think third is what I've been hopefully cut across throughout this conversation is the threats of climate change and nature degradation. This will without a doubt be the main challenge for this century. And it affects all of our organs in our bodies, from toxins in our water and our soil, everything from lead to PFAS in water and so forth are actually, unfortunately, resulting in both cognitive and as well as physical consequences. So I think that is very much part of what will happen. We see increases in vector-borne disease and waterborne diseases as a result of climate change. We see injuries as a result of effects of extreme weather events and so forth. This will only increase as we go along. I think the fourth maybe is non-communicable diseases, and this is related. So it's pretty much the top of the pyramid of non-communicable diseases. We have cardiovascular diseases. We live longer now, so we have more of these diseases as we grow older as well. But we see a lot of these diseases increasing rapidly, and we do not have access or proportional access of health systems and infrastructure to deal with this. This is everything from heart diseases to cardiovascular diseases to diabetes and so forth. And that will be an enormous challenge moving forward. And why it's also an enormous challenge is because before, if you had a communicable disease, maybe you would be cured or you would die. But non-communicable diseases are chronic and long-term diseases. So you need to be medicated and treated many times for lifetime. That costs societies a lot of money. So that would also be an enormous shift as people live longer and as we see increased economical growth in a lot of countries and access to services. I will probably stop at those, but I think these are some of sort of the main challenges that we will face looking forward in this region.
Yeah, I think especially the first one, I mean, I don't think any of these are fully well understood by general audiences, especially in the financial field. But I think that the demographic shift is something that has surprised a lot of people because, I mean, for a long time we've been talking about Japan. Recently we've been talking about Korea. And all of a sudden, China is popping out, and even some other countries around the region, which was quite surprising. So it is a massive challenge. Vera, I'll ask you a little bit of a tough question now, which is AIIB is going to deploy something around the line of $75 billion by 2030 or so, roughly speaking. What is there any rough idea on what potential proportion of this could support health-related infrastructure? And if so, how would you measure the success beyond the traditional financial matrix?
Yeah, so I mean, our health strategy is very new. It was launched less than a year ago. so it's hard to put a number on what proportion of our sort of entire health or entire portfolio will be for health. But what I'm hoping, or what we're hoping to see, is that we will have more of our traditional financing as well, really providing improved health benefits. I mentioned roads in the beginning, renewable energies, huge benefits for health. I'm sitting in a city here in Beijing that has reduced its air pollution by almost 60% in the last 15 years. That has dramatically improved health outcomes in this city. So I think what
I know that from personal experience. Believe me, going to China in the 90s and 2000s was not fun.
Yeah.
I mean, going to Beijing.
And that was a real decision I had to think about, bringing two small children to Beijing. But so I think what we really want to see is that we can have a catalytic effect in other sectors that really improves health outcomes. And I think that comes from bringing in this paradigm shift in our thinking to really think about health as something that can cut across in all sectors, or as we call it, sort of health in all infrastructure. So I think that will be critical. And I think in terms of, as you mentioned, sort of results, in a sense, it's really, in the end of the day, to see improved health outcomes, improved access, equitable access to healthcare services, to see improved quality of healthcare services, to be able to see improvement in terms of leveraging digital technologies, as I said, but also in the way that we can really mobilize more private capital into the healthcare sector. So I think all of these will really be a way for us to kind of show that we are going in the right direction. But we are also very much a bank that listens to our clients, which is our members, and what their needs are and what do they need. So it will all be based on what are their needs and how can we facilitate them to really improve their national health priorities.
Got it. One last question. Looking ahead, so there's something called the Development Bank's Working Group for Climate and Health. Looking ahead, how might AIIB's Development Bank's Working Group for Climate and Health change how multilateral development banks approach health and health financing globally?
Yes, this is actually a group that came out of a sort of a joint coordination after COP28, and with the real intention of trying, as a sort of more of a global community within the multilateral development space, think about how can we increase health financing in sort of in a climate constrained world, if you want. And as I was saying in the beginning, historically, health and climate financing has operated in complete silos. Health systems have been funded primarily through domestic budgets and traditional MDB loans, while climate financing was largely at the beginning focusing on energy, transport, adaptation projects. So this, what I think this group and what we can do together is really to sort of try to bridge that financing. And that is by aligning investments through our different frameworks, where we really look at this, specifically looking at the co-benefits of health in climate projects as well. So that's very much the first example, whether that is through urban infrastructure design, allowing for active transportation systems, way better to walk or to ride a bicycle than to take your car to work, but both for the planet and for people. Yeah. And it's much more affordable.
Of course.
And then I think differently, really sort of developing, innovating financial instruments. I think that would be very important. And that would also allow us to kind of attract private capital to do more sort of health-focused climate investments. I think that would be extremely important. And really using our balance sheets to leverage that. And I think the third one is really to build knowledge and evidence. And this is critically important in a resource-constrained world. How do we make sure that we are not overlapping our efforts? How do we coordinating? How we can kind of join in a way of financing new innovations and knowledge around this space? What are the best practices? What are different cost estimates on how you do this to really help guide countries on what they should be prioritizing in this space? What do they get as the best return of investment for different types of project structures? So I think that would be really important in this sort of intersection between climate, health, and infrastructure. And I think the last one is promote cross-sector collaboration. And I think that's really important because it's not only MDBs. We're working with UN entities, we're working with different institutions that are also very much moving the needle in this space. And again, working closer together, talking to each other, making sure that we are learning from each other, we are teaching each other, we are thinking together, will make the results so much better. Working in silos it's not going to be beneficial for anyone.
I mean, that's true for the transition in general, right? It's a rewiring of the way you think about it, right? So it's incredibly important. Vera, I really, really appreciate your time. I learned so much. I apologize for the very simplistic and naive questions. I think you're doing fantastic work, and I really, really hope that we can catch up sometime next year or whenever and get an update on how things are progressing. So thank you so much for participating in the Asia Climate Finance Podcast.
Thank you so much, Joseph. And I was very grateful to have this conversation. And I started this year after we launched this report to say that I will have more conversations with the unconverted, but really sort of bridging gaps between the health sector and the climate sector. And hopefully we shedded some insights on why we should think together and work together more closely.
I think you've definitely achieved your target there. You've done a good job of that. Thank you so much again.
Thank you.
Thank you for listening to this episode of the Asia Climate Finance Podcast. Please be advised that this podcast is presented for educational purposes only. None of the information provided should be construed in any way as investment advice. Always consult with a licensed investment professional before making any investment decisions. Additionally, please note that the views and opinions expressed by our guests are personal and may not reflect the views and opinions of their current or previous employers.